Welcome to the Friday Five here on the Agent Survival Guide podcast. I'm your host, Sarah Ruppel, and this is our weekly list of 5 things you should know about. It is finally the month of October, so rabbit, I hope you are taking advantage of the time between now and October 15th by holding those plan reviews with your clients, really maximizing this time that we have before the official start of AEP 2025. As far as the official countdown goes, just 11 days are left until the start of the 2025 annual enrollment period. So as we count down to our top story today, let's start with a new study from KFF at number 5. The study was released last week and looked at the tendency of Medicare beneficiaries to compare plans during the Medicare open enrollment period, or the annual enrollment period, as we call it on the agent side. Some interesting stats came out of that study, some that you can likely guess if you've been in our industry for a little while. So first off, their analysis comes from the 2022 Medicare Current Beneficiary Survey, which might seem old, but it is actually the most updated version of that survey that we have right now. The survey asked about choices beneficiaries made during the 2021 AEP concerning their coverage for plan year 2022. And there are some interesting takeaways that I think are important to highlight here. First, let's tackle the elephant in the room by revealing that 69% of Medicare beneficiaries did not compare their 2021 coverage with available options in 2022. On the other hand, 31% of beneficiaries did compare current coverage with available options. The study took a look at the breakdown of coverage type for those who did not compare their coverage, finding that 73% of those in traditional Medicare did not review their coverage, while 65% in Medicare Advantage did not compare coverage. I wouldn't say I'm surprised by those numbers, and in all honesty, they're pretty close. I would expect there to be more comparison in Medicare Advantage plans given the fluctuation in benefits, networks, and other plan features from year to year. Another interesting scope here, KFF also asked Medicare Advantage plan enrollees if they reviewed their plan year 2021 coverage for changes coming in plan year 2022. So, in addition to checking for comparing Plan A to Plan B, they wanted to know if beneficiaries were comparing Plan A in 2021 to Plan A in 2022, because, again, Medicare Advantage plans tend to change and shift over time. In this comparison, KFF found that a little over 40% did not look at their current coverage to check for changes in costs or services. 43% of Medicare Advantage plan enrollees did not review changes in cost from plan year 2021 to plan year 2022. And for clarification, costs include expenses like the monthly premium, deductibles, copayments, and other out-of-pocket expenses. However, cost is just one part of what clients can and should review when it comes to their coverage. On the services side, 44% of Medicare Advantage plan enrollees did not review changes between plan year 2021 and 2022. And services applies to types of treatments, drugs, and other covered services. So some interesting numbers there on the Medicare Advantage front, but let's move on to Medicare Part D. Probably not surprising, considering that most Medicare Advantage plans come with built-in Part D benefits, making it an MAPD plan. 82% of MAPD enrollees did not compare the drug coverage in their Medicare Advantage plan to that of another MA plan available to them. 82% did not compare current coverage with other options. 18% did, in fact, check their drug coverage. As for standalone PDPs, a little more comparison happening there. 69% did not compare the coverage in their standalone PDP to another standalone PDP in their market. 31% of standalone Part D beneficiaries did compare their coverage. And then another interesting takeaway that KFF pulled from that survey, the finding that a little over half of Medicare beneficiaries used resources from Medicare to educate themselves. Respondents were asked about calling 1-800-MEDICARE, visiting medicare.gov, and reading the Medicare and You handbook. 51% had not called the 1-800-MEDICARE helpline, while 23% were not aware that it existed. 36% of respondents did not visit medicare.gov, while 22% had no internet access. 31% had not read the Medicare and You handbook, and 15% reported they either didn't receive it or weren't sure they received it. Just 26% of respondents called the 1-800-MEDICARE hotline. 42% reported visiting the medicare.gov website, and 54% stated they had read all or some parts of the Medicare and You handbook. So, what is my takeaway from these numbers? Well, for one, there's certainly room for improvement. We talk about annual reviews, comparing coverage, and we've seen CMS implement a checklist of what agents should go over with beneficiaries before signing an application, making sure the client knows the effect of changing coverage compared to their current coverage. We've mentioned the importance of building that annual review into the client conversation right off the bat, so your client knows to expect it, that it's something they should be doing, and if you introduce it that way, it's a normal thing. Your clients don't know the value of a plan review unless you tell them about it, and they'll likely need to be reminded of it again because it's just not something they interact with and participate in every day. This AEP, we've been talking a lot about disruption and how individuals are possibly going to get a negative ANOC letter for the first time. You very well might get clients who've never shopped for coverage since they first turned 65. It's going to be a little bit of a learning curve for both agents and clients, but it will also inform your clients that this is a service that you can provide for them. And when they see that service performed in action, that's a little different than just hearing you say that you offer annual plan reviews. I look at these numbers and see the potential to help educate a lot of people. And for those of you with clients who haven't ever shopped but get a negative ANOC letter, this is a great opportunity to remind them how valuable of an agent you are. Moving on to number 4. We are currently gearing up for the annual enrollment period beginning on October 15th. And hot on the heels of that, we've got the ACA open enrollment period, which begins on November 1st. If you're an agent selling ACA plans, or if you've been considering selling ACA plans, we are launching a brand new summit just for marketplace agents. Next week, we are holding our first annual ACA Summit. It also happens to be the last summit of our 2024 season. There's a lot of info for agents at this event. Carriers will present their 2025 plans. Marketplace professionals will share their insights. You'll learn about marketing and sales support tools, as well as get vouchers for CE credits. And then on top of all that, you'll hear from Ritter Insurance Marketing's CEO, Craig Ritter. He is the keynote speaker. There's great food, raffles, giveaways, networking opportunities with both agents and our staff, and it is all happening at the Crowne Plaza in Philadelphia. If you have not registered yet, I would get on completing that registration. We will have the link in the episode notes. Super excited to add the ACA product to our lineup of Ritter Summits this year. Number 3, while we are on the subject of summits, I had the opportunity to talk to a lot of agents, answer a lot of questions, and get a lot of feedback. While we were at the Philadelphia Summit, I had the privilege of chatting with one of our agents about her business and how she likes Integrity's new software. She was super gracious, letting us capture her feedback so we could share it here. I know many of our agents have newly made the transition to MedicareCENTER, so without further ado, here is what she had to say about her experience with Integrity's software so far.
My name's Katie Hannigan. I do business in both New Jersey and now newly in Pennsylvania, mostly in Philly. I've been using MedicareCENTER for a little over a year now. Some of the things I love about it are how easy it is to tell if someone has any extra help or any LIS level. My most favorite thing about it is truly enrolling my clients through there, so later on I can go back, check up on them, review all their doctors, review all their medications. It's wonderful. And it really keeps you organized as well, so yeah. I've been enrolling clients through MedicareCENTER since AEP last year, but using it as a place of reference and resource and research since, I want to say, last summer. A little bit longer, yeah.
I just want to say thanks again to Katie. Really appreciate your feedback. Also, I want to make sure I mention that we've got a webinar coming up next week that goes over the basics of MedicareCENTER. If you have not attended one of those webinars yet, highly recommend checking it out. We will have the link in the episode notes so you can get registered and save your spot. Number 2, I couldn't not mention this update from Instagram because, well, let's be honest, it's me and it's about Instagram. Meta just released a new best practices guide for Instagram creators, and there are a couple things I would like to highlight here. First, I like the transparency from Instagram. Also, from a content standpoint, I love the fact that what they've done with this guide is essentially pull together a lot of disconnected content about best practices and put it all in one place. That is super helpful for those just starting out on the platform, whether they're brand new or they've just switched over to a professional account. The best practices section on the Instagram creator site is broken out into different topics: creation, engagement, reach, monetization, how Instagram works, and get started. Each section then contains reels that go more in depth on that particular topic. I do think it's important to keep in mind that these selections have been curated by Instagram, but I think there's a lot of good information and helpful nuggets in there that are important to know if you want to be successful on the platform. I have to say that the decision to populate this type of hub with Reels tracks as a deliberate strategy. Instagram has long suggested that they favor Reels, that short-form video content. So rather than linking out to blog content, using those Reels, that just makes sense here. If you're going to create a best practices guide, not only do you have to create the type of content people on your platform want to consume, it should be able to occur inside the app, and it should showcase your platform's preferred content mode while you're doing it. It's basically leading by example. You put out into the world best practices, and you follow them in your own posting. So if there was any doubt that Instagram was not all in on Reels, this pretty much confirms that yes, they are. Last thing I'll mention here, let's talk about the best practices features built into the professional dashboard within Instagram. As I mentioned earlier, you'll need to switch to a professional or business account to gain access to the professional dashboard. When you tap into that dashboard, you'll be presented with insights about your account and content, followed by a Tools section. In there, you can tap into best practices, achievements, inspiration, ad tools, partnership ads, monetization, trending audio, and more. Achievements is a fun gamification of posting on Instagram. And first and foremost in the Achievements to Earn section, at least on my version of the app, Reels. You can also earn achievements for views, stories, followers, watch time, posts, likes, and a few other metrics. The inspiration section was interesting. It should pull content into a feed that is similar to what you post, giving you ideas on how others are presenting content. I think this is helpful for people like me who are a little stuck in the mode of posting photos. It shows some different ways that maybe I could approach Reels and potentially find success. And then that best practices section gives suggestions across those same categories we mentioned earlier: creation, engagements, reach, etc. I will be digging into Instagram's recommended best practices and these new features over the next few weeks. And that's because at the end of November, we've got an episode on the books all about Instagram. So if this is a topic that interests you, keep an eye out for that episode. We have a handful of links with more information in the notes, so be sure you check that out as well. Now on to our number one story this week. Last Friday, CMS published a few projections and numbers that agents selling Medicare Advantage and prescription drug plans will want to know. They are also numbers your clients will want to know. First off, they started the release by projecting that growth in Medicare Advantage would continue in 2025. According to the most recent numbers available on the CMS Medicare Enrollment Dashboard, 34.1 million beneficiaries are enrolled in Medicare Advantage plans, accounting for about 50% of the total Medicare population. Enrollment is projected to reach 35.7 million beneficiaries in 2025, a number CMS quoted from the 2024 Trustees Report. According to their calculations, it will bump that percentage up to 51% of the total Medicare population enrolled in Medicare Advantage plans. CMS also reported that we would see a decrease in the average Medicare Advantage premium in 2025. In 2024, the average MA premium was $18.23 per month. That will drop to an even $17 per month for coverage year 2025. $0 premium plans will still be the case for about 60% of Medicare Advantage enrollees, should they stay in their current plan. Should they want to switch, there are still plenty of plans to choose from. We'll start with special needs plans, or SNPs, as we like to call them. CMS says, quote, in 2025, 98% of people with Medicare will have access to 10 or more MA plan choices when including special needs plans, end quote. As far as Medicare Advantage plans with prescription drug coverage that are not considered special needs plans, there's an average of 34 plan choice offerings per county. And when including special needs plans, 2025 boasts 65 total Medicare Advantage plan choice offerings per county. That is a lot of choice, a lot of opportunity for agent help in navigating those choices. Couple more things about Medicare Advantage worth mentioning before we move on. 2025 projected rebates per Medicare Advantage plan member will increase slightly, coming in at $210 per member per month. Vision benefits made it into 99% of Medicare Advantage plans, while hearing and dental benefits tied for the same percentage, both appearing in 97% of plan benefit offerings. Now, let's talk about Part D premiums for 2025. These are expected to decrease as well. In 2024, the average total Part D beneficiary premium was $53.95. That will drop by $7.45 to a cost of $46.50 for coverage year 2025. CMS also broke out the numbers for standalone Part D plan premiums, which are projected to decrease as well. Beneficiaries paid an average premium of $41.63 per month in 2024. They will see that cost go down $1.63 per month for a premium of $40 per month in 2025. As far as the number of plans on the Part D side, beneficiaries can choose from the average of 34 MAPD plan offerings by county or the average of 15 standalone Part D plans per region. According to CMS, the Medicare Advantage and Medicare Part D markets both remain in stable condition. The release outlined further updates coming to coverage for plan year 2025. A lot of it focused on the changes made to Medicare Part D through the Inflation Reduction Act. But there were also some updates outlined for the Medicare Advantage program as well. We will be linking to the full release in the episode notes. So now that we have the 2025 MA and Part D premiums and projections out of the way, I do want to acknowledge that at the time of this recording, we are still waiting on the Medicare Part A and B premiums and deductibles. As soon as that information is released, we will be grabbing those numbers and publishing an episode, so make sure you're following along with our show to stay updated. That is all we've got for this week's episode. I hope you have a great weekend. Stay healthy and stay safe out there, and we will see you next week. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an Integrity company. This episode was written and produced by me, Sarah Ruppel, script editing and fact check by Tina Lamoureux, podcast design by Urban Rivera, artwork by Vivian Zhao. Follow along with us wherever you like to listen.